everyone, my name is Sherry. I'm an aesthetic nurse here at BHPS, and today we're going to talk about Profound. So I've gotten a lot of questions about Profound, and today we're going to talk about how it works and what type of device it is, who is a suitable candidate. Today I'll answer that for you. So Profound is a radio frequency energy device with microneedling. So this is a very special device that goes into our dermis and then tightens up our whole face. It will give you a rejuvenated look. It will help you produce more collagen. And there's two types of tips. There is dermal and sub-Q. So dermal is for more of the skin, and sub-Q is more for the fatty tissue, which is a subcutaneous tissue. Helps with like your submental fat and like your thighs. So it will help reduce the appearance of a cellulite, and it will help to reduce some of the fatty tissue. So Profound can work on a lot of areas in the body. Mainly we do the face to tighten up the face, and then we do submental, we can do your neck, and we can do your thighs and your abdomen, anywhere that you need some tightening and reduction of fatty tissue. So Profound is good for people that are starting to notice their skin sagging, and you've tried Thermage, you've tried all therapy, and it doesn't really work for you anymore. I would go for Profound. And if you have cellulite on the body, like your thighs or back of your thigh, which is your banana roll, that we can also do Profound to help reduce that fat appearance. So people who have a pacemaker, who has heart arrhythmia, who's on aspirin, or have a unusual wound healing and extra like collagen formation, keloids, you're prone to that, then you are not a suitable candidate for Profound. So facelift is a surgical procedure that you have to go under for. People are usually under general anesthesia or they're sedated somehow. So that is a more invasive procedure. For Profound, you do not have to go under, and it is a minimally invasive med spa procedure that can be done in our office. So the difference between the three is that Thermage is a radio frequency energy device, and therapy is a ultrasonic focus device. And Profound is a microneedling with radio frequency. So they are all different method to help stimulate collagen, but this one is slightly more invasive and will have a little bit longer downtime versus all therapy or Thermage. So I recommend starting out with Thermage, then all therapy, and then go with Profound. So we recommend facelift if you are at the point where the machine we don't think would help with the skin sagginess. So that if you have excess skin and we can't really do that much with the machine, then we would recommend you go under the knife and then do the facelift. But if you are starting out, then we recommend starting with Thermage. If you're like in your early like 25 and up, yeah, I would start with Thermage, and then once you get to a certain point where you feel like that's not really working for you, then you can go up to all therapy. And then if you notice that your skin is sagging a lot, and then you see like fine wrinkles and like your nasolabial fold is starting to become very noticeable, then we can recommend Profound for that. So pain is a very subjective thing. Everybody has their own feeling of pain. We numb you very well, so we put numbing cream on for 30 minutes, and then we inject you with numbing. So first is topical numbing, then it's injection numbing with lidocaine, and then you're pretty much very comfortable at that point. You don't feel much. The most you'll feel is the numbing injection, which will be a little stingy, but the actual treatment part, you won't feel a lot. You'll just feel some heat, which is normal. Most people say it's tolerable. So usually Profound, you won't see an immediate result because right after you'll be bruised and swollen, so it's not immediate, but collagen production takes about 1 to 6 months. So the process will start to get going, and you'll notice more collagen and tighter skin. So I would say usually 3 to 6 months you'll see a pretty good result. Usually downtime is about 1 to 2 weeks. I tell my patients you'll be bruised for the first 3 to 5 days. And then afterwards, you'll start noticing your bruise turning from purple to like a lighter color, like green, yellow, and then they'll start to fade away. And then the swelling will also go as well. So yeah, I usually say 1 to 2 weeks. So if you could take maybe 2 to 3 days off of work, that would be good. So usually I would say the result lasts for 1 year to 3 years. So it depends on if you're a younger patient, you might need to get it one time and then you don't need it for like 2 to 3 years. But if you're an older patient, you might need it more often. I would say like 1 year, you might have to redo another treatment. So it really depends on how your aging process is. So we will decide that for you when we give you a consult. So for pre and post care, I would say stop any aspirin, fish oil, vitamin E that you're taking for 1 week, and then also avoid sun exposure for 2 weeks. And then also for post, also avoid sun exposure because it could give you risk of burning because you just did a RF treatment, which is a heat-based device. So we don't want you to go under the sun. And then also we want you to purchase Aquaphor and Arnica prior to the procedure so you can have it for after. So Arnica pill, Arnica gel helps with your body to break down the bruise. And then Aquaphor helps to hydrate your skin, so you want to put that on after you've done your treatment. And then also I would recommend icing for the first 24 hours, your post-treatment. You want to make sure the swelling goes down faster with the ice. And then use a medical grade sheet mask. That is very good for your skin for the first 3 days, like 2 times a day if you can, and then once a day for the rest of the week. All right, thank you for tuning in to our Q&A, and if you have any questions, you can leave down below in the comments, or you can always give us a call at BHPS. We're always happy to help you and assist you.